You know, one of the interesting things about medicine is that it's a career, it's a practice, it's a trade. It's one of the most noble of trades. But the thing that they don't teach you in medical school is that medicine is also a business. And it is a business that, interestingly, has gone through a cycle of unrestricted growth and cost expansion. So as a business person, it's imperative that we identify that it's an unsustainable model for the cost of healthcare to continue to increase. It's predicted that within 30 years, every dollar that's spent from the social services will be spent on healthcare. That leaves nothing for all of the other social services. We have to do something about that, and one of the ways that we affect that is by providing services in a cost-efficient model, a platform that allows value of care, tracks outcomes, but also keeps the cost in check, because none of us is going to be able to enjoy the technological advances of healthcare if it's unaffordable. So as a business person, it's been my mission to help be part of the solution of lowering the cost of healthcare, and I feel like that we're at the forefront of that. I feel like this is a very exciting time in healthcare, where there's a lot of doom and gloom that's associated with healthcare and healthcare expenditures. We're one of the brightest points on the map to recovery of healthcare as a business. In any industry, when you provide services that are as good as they can get, they're state-of-the-art, they're the best of their kind, and then you provide it in a way that provides value to the customer. And the customer is both the patient, the government, and the private payers, the insurance companies that actually have to pay for these treatments. When you're providing value and you're doing it in a way where there's no compromise to the care, there's no compromise to the outcomes. In fact, the outcomes are oftentimes better than they can be enjoyed in any other platform of delivery. You can't help but be successful. At CiC, we've been able to leverage our model in such a way that it is reproducible in any geography. That's allowed us to expand to 5 states since the inception of CiC in 2013. Really, the sky's the limit as to where our model can be deployed, because it's so much what the country needs healthcare to be. The concept of physicians making the clinical decision of what happens to a patient in their healthcare, but also participating in the business decision of how that healthcare is going to be valued. That is the hope and dream of all practitioners of healthcare. We want to be able to look at our patients and say, not only are you going to get the best care from me and my staff, but we're going to do it in such a way that it's not bankrupting the country. It's going to be sustainable going forward forever. Looking back on my career, it's been very gratifying to affect every one of the patients that I've had the honor and the privilege to help them go through a difficult time in their life and come out better. But I also want to be known as one of the people that tackled one of the problems of healthcare, and that is that it's unaffordable, it's difficult to access, and it's frustrating to deliver value, and I want to be one of the architects of the solution. And I want to look back at my career and say I want people to say not only was he a great physician, but he helped healthcare be sustainable for his children and his children's children.